Hello, Obooters from around the world. My name is Kais and I am 12 years old and I live in Boston, Massachusetts. Welcome to our Oboot Zoom session where me and my co-host Amira, who is 12 years old and also lives in Boston, Massachusetts in the United States, will be interviewing our guest changemaker Ndakuna Fonso, who is from Cameroon but is currently studying at Harvard University. Ndakuna is a social entrepreneur and a business transformation expert with a background in nursing. He is the founder of Harda healthcare clinics and hospital in Cameroon. Ndakuna work links to several sustainable development goals, especially to goal number 3, health and well-being. Amira and I will ask questions to Ndakuna about his background, his journey, his work, his skills, and his impact. We hope that you will enjoy this session, and I will now start with our first question to our guest. Can you please tell us a little bit about you and what you do for work?
Thank you very much for having me. So I am Ndakuna Fonso Amidou from Cameroon. I come from a small village in the northwest of Cameroon called Bambalan, where I was born and bred. So I grew up in Cameroon, went to school in Cameroon, and then after high school I did nursing. After nursing I left for the United Kingdom. So that's kind of my background, but I later on went in a more changed career, went into nursing and went into telecommunication. So I trained as an engineer, and then did other things after that, including starting a number of healthcare clinics in Cameroon, and now working on building a full hospital.
Why did you start building clinics in Cameroon? What inspired you?
So it wasn't planned. I was working as a mental health nurse at the time in the UK. I visited Cameroon, and like I said, I grew up in the village. So when I visit Cameroon, the first thing I do is I go to the village. And at this point in time, there was no healthcare center in my village. While I was visiting and in the village, my next door neighbor went to the farm, sustained a wound, and because she had no access to a nurse to clean and look after the wound, it got contaminated and she died as a result of that. But all of this happened while I was in the village, and I had to make a decision whether just pretend as if I have seen nothing and move back to the UK where I had a comfortable life, or to try and do something about it. I decided to do something about it, and that's where I started the first Harda polyclinic. It was more, the beginning was more bravery than anything that I had planned, but over the number of years that have passed, 14 years now, I kind of improve, how I now do these activities.
All right. Do you plan on making any other clinics in different countries?
At the moment, that is a long-term vision. So my short-term vision is, at the moment, like I said, I started in my village, then I expanded to city, like the biggest city in Cameroon, Douala. That I have a number of healthcare clinics there now, and that's also where I'm building the hospital. My short-term vision is to build the biggest hospital in Douala, but I also have a long-term vision, which is to replicate the same structure across Cameroon and Africa. So we're looking about the 10 years out from now.
Imagine your dream hospital. What does it look like?
My dream hospital is the one that provides end-to-end healthcare services to people that are sick. And if I use any word which you don't understand, you please ask me, and I would explain. End-to-end, I mean that a lot of people, when you're sick, you go to the hospital, it might be that what you need the doctors to do or the nurses to do is what we call primary care. So, it's maybe just, you go through consultation, you give him some medication, you go home. But it might also be that you need more than primary care. So you go into secondary and tertiary care, which means that the doctor who does the consultation might think that you need an operation, for example. What typically is happening at the moment in Cameroon is the primary care facilities are very distinct or different from the secondary and the tertiary. So my dream hospital is one that brings all of this together. So I'm building a hospital that connects the primary care services into the secondary and tertiary. So we have a situation where a patient don't need to be visiting different structures to get the care that they need. So they can get everything at Harda Polyclinic.
All right. Do you sometimes do work in your clinics, or do you only own them?
So I try not to get too involved into it. This is because beside Harda Polyclinic, I also have a private professional life, which I do independent consultancy work for different organizations. So the way at the start of Harda Polyclinic, I was very involved. I was involved in every decision, getting a new location, recruitment, who is setting the rules and regulation, etc. But over 14 years, I've built a very solid team. I built a team that I trust. They know exactly what they're doing. So my involvement is more to do with supervision, and when, for example, we have to engage a new partner into the business, that's the kind of things that I get involved in. Then I checked the general operation of how things are going. I designed a strategy and discussed with the team. So I own the direction of the next step of the organization, if you like, but I don't get into too much operational issues, which my team is able to deal with.
Why a goal of good health and well-being is important to you?
I think this is just a fundamental aspect of life. If you think about it, we all have to be in good health to do all the things that we aspire to do in the world, right? You want to learn, you want to be an expert in, you have an aspiration to learn, be an expert tomorrow in a particular field, but you can't actually do that if you're not in good health. So the good health is the foundation for almost everything that we do in life, and I think that's one of the biggest reasons that I find myself doing what I'm doing, because you can see the impact across board, irrespective of what your motivation is, how motivated you are. If you're in good health, it is that limits whatever you can achieve.
What would you say is probably the hardest part about your work?
The hardest part of my work is trying to make sure that everyone, irrespective of whether you have money or not, that you have access to this healthcare, the healthcare services that I provide. I come from a country where most healthcare services is still paid out of pocket. So, and then if you think about where I start an organization that is fully focused on, I want everybody to have access to healthcare, irrespective of whether you can pay or not. Then I kind of grow over time, and I have this, a bigger organization now that is still expanding and getting into more services. And so it becomes even more difficult. It's okay to say that somebody comes to the clinic, they get a primary care, and they don't know if they don't have the money to pay for it. It's easy to work with that. But you imagine a situation where it's more than that. So that person needs, say, a pregnant woman turns up, they cannot give birth through the normal process. They need what we call a C-section, which is an operation. That operation probably costs something in Cameroon. In Cameroon, it will cost something like $500 or $300, $300 to $500. Now, the biggest challenge I have is, what if that woman cannot pay? I cannot obviously turn them back, to go home because they don't have money, because that defies the whole purpose for which I started this organization. So it's having to work with challenges like regarding, how the healthcare services are funded for, especially for people that don't have the money to pay. So I have to think about, how do I integrate different business model across the structure that I have to be able to accommodate both those who can pay, who can then supplement for those who cannot pay.
What is the most important thing you learned in Harvard?
Harvard, the most important thing. Oh my God, that's a difficult question. Let me think. I think one thing that I've certainly learned is the fact that outside the classroom, we have networks that can actually help us solve the problems that we are looking to solve when we come to places like Harvard. So I came here with a mindset of, okay, I have all of these issues I want to address. I'm going to go to my classes and see if I can find answers or solutions. But I find out that most of the progress that I have made in resolving my challenges has actually come outside interaction, outside the class. So the people that are in my group, the people that I interact with. And yeah, an example is it's RIM, because what happened is I have been struggling to find, because as you can imagine, we don't have a lot of specialist medical doctors in Cameroon. And I have been trying to find a solution to this, being a structure that is located in Cameroon. And yeah, I thought I was going to find that solution through a course, but in a discussion with Rim, she actually came up to me and made a proposal for me to have a chat with Nadia, who is her genuine sister. And I'm at the place, I'm in position now that I'm at the position where I'm about to sign an agreement with an NGO, which I got introduced to by Nadia. So the interesting bit, or the most interesting thing, has been just realizing that that network is actually more important than some of the classes that I'm too focused on in terms of finding solutions to the challenges that I have.
Okay, so how was it like growing up? Because you said that there was no healthcare clinics until when you made Harda Polyclinic in your village. So how was it like growing up without something like that?
So I come from a family of 7. I am the last. My parents never went to school, so my mom was she worked mostly on the farm, and then spent a lot of time looking after the house, so what some people will call housewife. My dad was a fisherman. So I grew up in the village with my siblings. I come from a very big family. My dad had 2 wives, so I have many half brothers and sisters. We all grew up together. As a child, and even as we speak, my village, which I grew up in, don't still have electricity. So I had my childhood was one of not having to live with electricity. I had to go to school, come back, and I would do my homework using the local lamp. I'm not sure if any of you have seen what that looks like. But that's how I grew up, and I didn't leave the village until I was going to high school. So from high school, I was lucky enough I was privileged enough to go to a boarding school in town. That was because one of my brothers had left Cameroon and was living in London, and he was able to sponsor me at this boarding school. So from there, things started getting better for me. After that boarding school, I did nursing that I was talking about, and after nursing, I found myself in the United Kingdom. So not a great start to childhood, but I kind of picked up in between. One thing I didn't mention is I started school very late. Because apparently, from what I hear, I didn't want to go to school. So I got to about 10, and I was threatened that if I didn't go to school, a lot of things were going to happen to me, and that's how I finally, decided to go to school. My dream was to become a fisherman, because most of the successful people I know in my village are fishermen, right? And growing up as a kid, that was my dream. But the family forced me to consider school, which I think is the biggest thing that they've done to me, because I definitely think that I'm better today being educated than being a farmer. So a fisherman, sorry. So that's kind of where I come from. Yeah.
Where do you see yourself in 5 years?
Wow, in 5 years, I definitely have a number of goals. At least 2 of them are I grow my independent consultancy work and expand from Europe to other continents like Africa. But the more important one is the hospital. So I hope that in 5 years I will be running the biggest hospital healthcare provider in Douala, which is the biggest city in Cameroon. So I'm hoping that in 5 years that project would have been completed, and at that point I will be thinking about an expansion to make it a nationwide project.
So, how did Corona affect your work?
Corona, it's interesting, and it didn't actually affect my work too much. That is the short answer, and I will explain why. The impact of Corona in Cameroon has not been at the same level what we know in Western countries like America, for example. So we've had very few cases in Cameroon till date. And so thinking at the top of my head, we've had less than 1,000 deaths from coronavirus till today, I think. I might be wrong, but the number will not be too far from that. At every given time in the whole nation, we have about 50, 100 or maximum 200 people that have tested positive and are being looked after. So overall, the impact of Corona has been, quite manageable from a Cameroonian context. Most impact has been external, which is Cameroon depends on a number of countries for different things. So whether that is medical supply or other things, and because these countries have been affected, it means that for Cameroon, deliveries into Cameroon of these essential items have been in one way delayed or become more expensive. So I would like to think that in summary, the impact of Corona in Cameroon has been more external than internal.
If you could go back in time and change one thing, what would it be?
Is that in my life or in the work that I do?
Anything, I guess.
Go back and change one thing. Maybe that would be going to school early and not being a rebel who did not like school to start with. Because throughout my life, I kind of feel like I'm having to play catch up throughout, because I went to school very late, which meant that I started my career late, and then so when I look at people who are at the same age like me, I tend to think that, maybe if I started school when I was supposed to start school and I took things serious, I probably would have, done more at this stage in life. But hey, this is the reality, and I have to deal with whatever I have today. So I at the same time, I have to really, I have to be appreciative of the little that I have been able to do with my, my life to improve my community. Sorry, I can't hear you, Kel.
Yeah. What do you do in like your other job, not the Harda Polyclinic thing?
So, like I was saying, I have a background. After nursing, I moved into telecommunication. So I worked for a number of telecoms company, Vodafone, Motorola, even the United Nations. Then at some point, I decided to start an independent consultancy work. So I have a company that advises other organizations on data privacy. Data privacy is this thing that I don't know how. Let me try to see if I can break this down. Each of us interacts with different organizations. For example, we all have a mobile phone. If that mobile phone is on a phone contract, it means that you have a contract with the mobile operator that is providing you service through that mobile phone. In that contract, you will send some of your information, you will share some of your information with this operator. So maybe obviously they will know your phone number. That contract will state where you live, and that contract might also collect other information. So any information through which you can be identified. So it might just be your postal address. Now, because you share that information with them, under the law, they have a responsibility to make sure that they look after that information well, that nothing happens to it. That they don't have people breaking into their system and collecting that information, maybe to cause you harm, for one reason or the other, or that within the organization they have that data exposed and it's not really looked after it. So this is why we have this thing called data privacy. So data privacy sets the number of principles and regulations how all of these organizations need to be able to manage the data that they collect. Now you can expand this to all sorts of companies. It could be energy company. It could be an online platform like LinkedIn or Facebook and other organizations with whom you share data. So they all have this responsibility to look after that data once they've been shared with them. My role is to then go in, look at what they have, because I know where they should be in terms of looking after that data. I can look at what they have and see where they have gaps, and then help them to address those gaps. So that's what I do. This is how I look for money to fund the hospital.
How kids can prepare to make a change in health and well-being?
Sorry?
How can kids prepare to make a change in health and well-being?
Yeah, I think for young people, when you start off, I think the most important thing is just to learn as much as possible. You would get to a point where you start to see, along that journey where you start to see things that you can get involved in. You can see from my story, I didn't plan to get into healthcare, but I did. But that's because it happened at the point where personally I could connect to the things that was happening around me, right? I could connect to it because I grew up in that environment. I could connect to it because I was a nurse and my, I have that duty of care to look after patients. So I think over time, you kind of figured that out as you go. There's not a real script out there for you to try and follow. But the most important thing I would like to mention is you cannot help another person if you're not in good shape, right? So you need to think about, learning as much as you can, taking advantage of the things that, opportunities that you have around you, things that are being offered to you by your parents and people that surround you. Because with that, you find yourself in a situation, eventually you find yourself in a situation where you can then start to help other people. But if you're hungry, there's no way you're going to be helping other people. So that it's really important. I know I'm not going into the exact details, but I hope you kind of get the idea of how you can move from where you are to support other people, because well-being is just one thing. There are other things which you might end up not just doing health well-being, but those other things as well. But before you get to them, you need to make sure that you look after yourself. You're in a position to be able to offer help to others, right?
All right, I have one last question, and it is, what does your workplace look like normally?
Right. So with my consultancy work, I go into different organizations, and when I do, they will have to decide where I can sit, and then that would also involve them carving out a team to work with me. So I will I'll probably sit in an open area with somewhere in the organization that have the team that I'm working with sitting around the same area with me. But at least in the last 1 year plus, because we've been working from home, it's just been my desk and a laptop to work from. So that's kind of what my work environment looks like. But I changed quite a bit because we're working with different clients. That environment means that environment is different as you go from one client to another, right?
Okay, I have one last question also. Yeah. I know that you like football. I have two quick questions. First question is, who do you think will win today's African Cup, Senegal or Egypt? And who do you think is better, Messi or Ronaldo?
Right. I think that Senegal will win today. I support Senegal, but that's probably just emotions. Because Cameroon was beaten by Egypt. I feel that Egypt might be a better team in terms of the players that they have and what they can do. But I would like Senegal to win. In terms of who I prefer between Messi and Ronaldo, I think I prefer Ronaldo. Messi was born with everything. Like, the guy doesn't have to work too much to be what he is. I like the fact that Ronaldo has had to put in work. He's had to, build a winning mentality. He's had to go look for it. And I see that very close to the type of person that I am. I like I said, where I come from to what I'm doing today, it's, I've had to think in a similar way. Obviously, Ronaldo does it at a bigger scale than me, but I see a lot of myself in Ronaldo, and that's why I prefer Ronaldo.
All right, so thank you, Oboot, for listening to this interview, and thank you, Ndakuna and Amira, for the great discussion and for everything that we learned today. And
Go on, sorry.
And make sure to follow us on Instagram and Twitter, and to subscribe to our YouTube channel so you can hear about upcoming sessions with other change makers. And last but not least, go to Oboot.co to learn about opportunities to collect digital badges and draw down carbon.